Hello, I'm Dr. Danielle with a Q&A session. What does it mean to be symptomatic? Let's look at it. What is the definition of a symptom and of being symptomatic? A symptom, from the Greek accident, misfortune, that which befalls, is a departure from normal function or feeling which is apparent to a person, reflecting the presence of an unusual state or of a disease. Symptom can be subjective or objective. Tiredness is a subjective symptom. When somebody says, I'm tired, it's difficult to say, well, how much? I'm not sure you are. Are you very tired? A little tired is very subjective. Whereas cough, everybody can see when somebody is coughing, or fever, which you can measure, are objective symptoms. They are usually noticed by the person or the entourage if the person does not notice themselves that he or she is under stress. And for example, paresthesia is a symptom. Only the person experiencing it can directly observe their own tingling feeling, whereas erythema is a sign anyone can confirm that the skin is redder than usual. So some people make the distinction between a symptom and a sign. So being symptomatic is simply departing from normal function or feeling. It can be very obvious or quite subtle. An extreme symptom can be somebody having a seizure or a heart attack. It's visible to all. But what about invisible wounds? Do they have more subtle symptoms? Let's talk about PTSD, post-traumatic stress disorder. And the name is changing. Maybe it's more PTSI, post-traumatic stress injury, or PTSS, like the French calls it, post-traumatic stress syndrome. A syndrome is a set of symptoms. Some people like to abbreviate it, PTS, post-traumatic stress, and now it's also considered to be a TBI, traumatic brain injury. The problem with the word disorder, it has a stigma. And it's a mark of disgrace associated with a particular circumstance, quality, or person, and nobody likes to be stigmatized. So it's important to have a proper name for a condition. So PTSI might be the more realistic one, the true one. It's an injury, it's not a sickness. It's simply a normal reaction to an abnormal event. So let's look at this invisible wound. PTSD has long been described as an anxiety disorder. However, recent research has shown that PTSD symptoms are similar to the behavioral and emotional symptoms of a traumatic brain injury, which is caused by the blow to the head. Dr. Amen says PTSD is not a mental disorder. PTSD is a brain disorder. PTSD is usually referred to as a psychological issue. But even though PTSD can impact your psychological well-being, it's not a mental disorder. It's important to understand that struggling with symptoms of PTSD is not a character flaw or a sign of personal weakness. Advanced brain imaging using a technology called SPECT shows that PTSD is a biological problem in the brain. So here are two SPECT scans. One, the brain of somebody who has PTSD. You can see there's more yellow and reddish all around the brain, as somebody who doesn't have PTSD does not have many of these yellow or red areas in the brain. So how does emotional trauma injure the brain? We consider that the brain has three parts. The reptilian brain, way deep inside, it's also called the dinosaur brain. It's your instincts, your reactions. Then you have the limbic brain, also called the mammalian brain. It's where you have emotions and the seats of feelings. And the neocortex is a rational or thinking brain. During a traumatic experience, the reptilian brain takes over. It helps you to react, shutting down all non-essential body and mind processes and throws the body into survival mode. Normally, when the immediate threat goes away, the parasympathetic nervous system takes the body into recovery mode and lets the brain go back to its normal top-down structure of control. But for those with post-traumatic stress, the brain doesn't shift back into normal mode. The reptilian brain, activated by threat, keeps the survivor in a constant reactive state, just like if the person had received a blow in the head. Every cell in the body records memories, and every trauma-related neural pathway can be reactivated by a triggering event. This is what creates post-traumatic symptoms such as flashbacks. What is legal abuse syndrome? It's a subgroup of post-traumatic stress injury. It's an injury that happens during litigation. The P in PTSI is actually peri, meaning it's not post, it's around. Because people who are diagnosed with LAS, legal abuse syndrome, get it while they are in court, while they're going through the litigation. They do not get it after the event, they're getting it in the event itself. So most people going through protracted litigation will end up with symptoms of LAS. Why? Because even though people believe that justice is blind, it is not. It is often cruel, unfair, unkind, disrespectful, accusatory, where lies prevail. It's a shock to the system. It's an injury to the brain, like you received a blow. And Dr. Karen Huffer recognized this and wrote her first book, Legal Abuse Syndrome, to help litigants. And then she created the organization Equal Access Advocates, again, to help litigants and also to train people to become advocates to help litigants going through litigation, protracted litigations. Litigants with LAS become symptomatic. They're afraid to get their mail. They're anxious when they have to open the inbox to check their emails. Traveling to court, ooh, they worry. Receiving information from their attorney or the opposing attorney, it's always traumatic. They have lost trust in their attorney's ethic and in the judge's neutrality. They have a deep sense of men's inhumanity to men. They receive bills about legal costs and they worry some more. They lose the quality of life, some lose their health. Some people even lose the support of their friends and family who don't understand what's going on. And this is just a partial list. We have a basic functionality screening document, and you can request it at the end of this presentation. You'll get all the information you need to contact us and request the basic functionality screening document. So what are stress symptoms? Well, according to WebMed, emotional stress shows up as people becoming easily agitated, frustrated, moody, feeling overwhelmed, like they're using control or need to take control, having difficulty relaxing and quieting the mind, feeling bad about yourself, have low self-esteem, feeling lonely, worthless, depressed, and try to avoid others as much as you can. You don't want to go shopping, you don't want to go to meeting, you don't go to picnics and barbecues. You basically want to be left alone. What are the physical symptoms? Very low energy, headaches, upset stomach. You can have diarrhea and constipation or alternate between the two or be nauseous. Aches and pains and tense muscles, chest pain and rapid heartbeat or irregular heartbeats. Insomnia, you can sleep at night. Frequent colds and infections, loss of sexual desire or ability. Nervousness and shaking, ringing in the ear, cold and sweaty hands, or dry mouth. And even clenching your jaw, grinding your teeth during the night. Let's look at cognitive symptoms. Constant worrying, racing thoughts, forgetfulness and disorganization, inability to focus, poor judgment, being pessimistic or seeing only the negative side of about everything. As for behavioral symptoms, your appetite may change. You may eat too much or not enough. You may procrastinate or avoid responsibilities. Increased use of alcohol, drugs, or cigarette is it's usual. Exhibiting more nervous behavior such as nail biting, fidgeting, and pacing. Now, people cope in different ways, and most people have one or two different coping mechanisms. This is a people that have the fight coping mechanism. What do they show up? As self-preservation at all costs is very important to them. They have explosive temper and outbursts. They may become aggressive and have angry behavior. They want to control others or bully them. They can't hear other points of view. They have a pronounced sense of entitlement, demands perfection from others, and have dictatorial tendency. And they often mislabel as being narcissists, sociopaths, or having conduct disorder. Another coping mechanism is a flight coping mechanism. People there become obsessive or have compulsive behavior, have feelings of panic and anxiety. They rush around, they overworry, they're workaholic. They can sit still, they can't relax. They try to micromanage situation and other people. They always on the go, busy, busy, busy doing things, want things to be perfect, and they overachiever. They often mislabeled as OCD, obsessive compulsive disorder, bipolar, ADHD, attention deficit hyperactive disorder, panic, and mood disorders. Another coping mechanism is a freeze mechanism. People space out, they feel unreal, they hibernate, isolate the self from the outside world, they couch potato, they dissociate, they have brain fog, can't think, difficulties making decisions and acting on decisions, achievement phobic, wants to hide from the world, feels dead, lifeless. And they often mislabel as clinical depression, schizophrenia, ADD, attention deficit disorder, or DID, dissociative identity disorder. And the last is a fawn coping mechanism. There, people become people pleasing. They're scared to say what they really think. They talk about the other instead of themselves, flatters others to avoid conflict. They are angels of mercy. They overcare. We can read sucker on their forehead. Can't stand up for themselves or say no. Easily exploited by others. They're usually concerned with social standing and acceptance, about fitting in. They're a yes man or a yes woman. And they typically mislabel as being codependent or a victim. So check yourself. Do you have any of these symptoms in your body? Headaches, frequent infections, taut muscle, muscular twitches, fatigue, skin irritation, breathlessness? Is your mind worrying? Or do you have muddled thinking, impaired judgment, nightmares, indecisions, negativity, or make hasty decisions? How about your emotions? Have you loss of confidence, feeling more fussy, irritable, depressed? Do you have apathy, alienation, apprehension? How about your behavior? Are you more accident prone? Have loss of appetite, loss of sex drive, drinking more, or insomnia, restlessness, smoking more? Those are subtle symptoms of stress, of PTSD, post-traumatic stress disorder, or LAS, legal abuse syndrome. So if you have any of these and you'd like some help or more information, you can contact us. We have a physical address in Colorado Springs. We have a website with a lot of information. You can contact us by email if you would like the screening I talked about, or you can give us a call. And also, you want to stay tuned for more educational videos. Hope to see you soon.